The U.S. has now passed more than 6 million coronavirus cases and worldwide more than 25 million. The number that is now increasingly coming under scrutiny is how many people have died from the disease. Joining us to break this down is Dr. Dara Kass, Yahoo Finance medical contributor and Columbia University Associate Professor of Emergency Medicine. Yahoo Finance's Anjali Kamani is here as well. Dr. Kass, the CDC is now saying only 6% of COVID deaths were due to the coronavirus alone. Why is this significant?
So what they did was they said that the 6% of patients who died of the coronavirus exclusively, meaning that they didn't have any other comorbid conditions. Most people haven't filled out a death certificate. So when you do, you list a cause of death and then you list other causes of death, things like hypertension, respiratory failure, COPD, diabetes. And so what the CDC did was they really manipulated the data to say that there were 6% of patients that had no comorbid conditions, no other contributing factors, which itself is kind of, it's overwhelming. The idea that 6% of the people that died of the coronavirus had none of these other contributing factors or comorbid conditions. So it has created this narrative that the death toll has been overestimated, and that is not accurate. And we really need to remind people that the coronavirus is a deadly virus that has contributed to the death of almost 200,000 Americans and has infected 6 million Americans. And we need to keep focused on the fact that we need to address this pandemic head on.
How does this actually then get counted? Because I've heard, just as you have, this conversation about whether or not the death toll has been inflated, and there were also reports earlier on that there were undercountings, of individuals who were in nursing homes or outside of the home as well. So it seems like there continues to be a lot of confusion about this number. What would you say is a better way to look at it?
So I think that's true. There's a confusion. In the beginning, we didn't have enough testing. People were dying at home. There's this concept of the excess death rate, meaning that people who die above what a normal number would be for this time last year. And we're still above the excess death rate of what we'd expect at this time any other year. The truth is, this comes down from the idea that the federal government has not put a transparent and consistent metric for how to govern deaths from this virus and even infections and how to count them, and hasn't been consistent in that way. If we had better understanding, even training of how to document the deaths when coronavirus is present in a patient, and more importantly, how to document that consistently, we'd have a lot better data, but we just don't have that.
Doctor, the FDA has come out and said it's willing to fast track a vaccine before phase 3 trials are over. Is this unprecedented? And what does this mean?
Well, I mean, we talked about this last week, right? After the plasma, remember convalescent plasma, Brian, where we.
I do remember. Yes, I do.
Where they changed the guidance based on political pressure, the FDA, and we said that the worst case scenario would not be the plasma, but would be, does political pressure change how we fast track a vaccine? In fact, we're seeing now that the FDA says they're meeting October 22nd to discuss the viability of a vaccine. Now, what does that date have to do with anything medically? It doesn't. Right? So the idea of actually approving a vaccine before phase 3 trials are complete is unprecedented, but it's also potentially unsafe. We want a safe and effective vaccine as soon as humanly possible. We have a lot of candidates out there, but we need to remember that political pressure and a vaccine, it doesn't just undermine whether or not the vaccine is safe. It actually undermines whether or not it will be taken by patients long term and would have a years-long effect on this virus and honestly on the economy.
Dr. Kass, I think this brings to mind, the conversations that have been happening in the scientific community around the announcements from China and Russia already using their vaccines on individuals prior to phase 3 being complete, and the criticism that has come from that. Yet we're hearing here in the US that it might be okay to go ahead and do that. I see you shaking your head. So tell me why that's wrong.
Because nobody's saying it's okay to do it. People are saying they actually might do it. And I think that that's the conversation we need to be having, right? Other scientists, physicians, not receiving political pressure, who are saying this is a good idea. And if they are saying it, why are they saying it? We haven't seen any of those scientists come forward and say, it's time to fast track a vaccine out of consistency from our safety trials in America and follow the lead of China and Russia. I mean, I just can't imagine a scenario by which we would choose to follow the lead of China or Russia on anything else.
Fair. On the point on Commissioner Han's comments, though, it seems like this whole time there's been, a lot of effort put into, comforting the American people and saying we will not, approve a vaccine that's not safe and effective. Are these competing comments then at this point?
They are actually, because you see one messaging on one side and then you see actions on the other. And so the problem we have right now is they're not consistent in their message and in their actions. And so what we need is to see them walk the walk for a while and not undermine themselves. The CDC and the FDA in the past week have both have to go back and walk back comments they made about safety or recommendations on testing or therapeutics based on political pressure they've had, where they've had to correct themselves. That doesn't help any public confidence in a vaccine when it comes out.
Doctor, switching gears a bit, schools, colleges are reporting a rising number of infections. What does this mean for kids as they go back to elementary school? Obviously, elementary school kids are not playing beer pong in crowds like college kids, but still, what should parents expect?
So we hope that they're not playing beer pong, right? At 6 and 7 years old, although we never know, it's a pandemic. But the truth is that the college kids are, they're getting the virus outside of the classroom. And so the controlled environment for them is very different. And obviously alcohol is a bad idea. So that's why bars have been closed, because, you get disease transmission when you have intoxication. What we think is going to happen is that public schools should be okay, but the colleges themselves are not being consistent in how they're reporting the data. You'll see a University of Alabama discuss 1,200 cases as an outbreak, and then you'll have other institutions that refuse to publicly, disclose the data on their outbreak, citing privacy. And that's really hard both for parents of children that are in the schools and for doctors in the community to understand where disease transmission is. So what we really need, again, is federal guidance on transparency from a joint statement from either the HHS and the Department of Education, saying what colleges should be doing to disclose the coronavirus cases in their institutions so that we can model that for the communities writ large.
Doctor, what are we seeing in terms of other countries? Obviously, we're not the only one dealing with this. When it comes to the school reopenings, any best practices emerging that we can follow?
Yeah, I mean, most of the countries that have had, the virus under control is first and foremost, right? So opening schools when you have a very low viral prevalence rate, less than 5% of a positive test rate, available testing, rapid testing, and then the ability to pivot to remote to shut things down. I think one of the best examples would be in, Australia, where they had an outbreak, they shut things down, they got it under control, and they're continuing to ebb and flow with a few cases, 10, 20, maybe even 100 cases, not the thousands and thousands of cases we're seeing every single day here in America.
Doctor, before we let you go, Nestle making a big play for a company that's developed a solution to peanut allergies. Is this the real deal?
So what they bought was a company that does peanut flour in pill form, which is part of something called oral immune therapy. It has to do with desensitizing kids to peanuts. And so there really they're basically being part of a solution that hits their market hard, right? The idea that may contain peanuts or even peanut containing candies for allergens for kids does affect how parents buy chocolate. So I think it's a very interesting partnership. I think that it's something we should watch. Obviously, they think that this is a market that they can help improve by getting this oral immune therapy into kids' hands and helping desensitize them to peanuts. And I'm going to talk about it with 2 of my 3 peanut allergy kids and see if they want to be part of that trial.
All right, well, keep us posted there. Okay, Dr. Dara Kass, Yahoo Finance medical contributor and Columbia University Associate Professor of Emergency Medicine, and our very own Anjali Kamani. Thank you both.